Hello, namaste, buenos dias, здравствуйте, bonjour, bienvenue, comment allez-vous? Merci, bien, merci. Welcome to IFL-SC Global Academy. I am Marie, Professor Marie, and it's a pleasure to have you here again as we explore a deeply relevant topic today. It's a very important topic. It's about how can we develop health equity through integrated approach involving public health, involving gender dynamics, involving global policies, and involving even behavioral sciences. But first, let me tell you, as usual, why I'm here. My mission in life is simple but divine, to serve God and also to serve humanity. And I do that through my platform, which I call GREAT. Great. Gender equality. G stands for gender equality. E stands for education and empowerment. A stands for action for climate. And of course, T stands for training for the future. That's a platform I use. That's the walk I walk. That's the path I walk. And I want to take everyone along that path. But before we begin, please click subscribe, okay, down there. Give us a thumbs up so that the volunteers can continue to do a lot of work, because each time you click, okay, you help us reach more lives. Now let's dive right into the topic. Our world is evolving. Our world has developed. Our world is technologically advanced. It's globalized. However, inequalities still exist. Now let's look at health outcomes, for instance. They are not distributed equally. Okay, for us to achieve sustainable development, we have to make bold steps. The world has to make bold steps to make sure that there is an interconnectivity, an interdisciplinary approach, strategies, so that a lot of things should be shared equally among the nations. Now, there's still a lot of challenges. Let's look at medical supplies, for instance. Look at the African situation and other developing nations. How many women are aware of things like breast cancer? Just information. How many women are aware of common high blood pressure? How many women are aware of what you call high sugar level or low sugar level? How many men are even aware of prostate cancer? In many of these countries, you will be surprised that even when the government makes available facilities that exist, health facilities, you still find out how many people even know that these services are available. How should we make them know? Now, how do we bridge that gap? Now, if you look at a man or a woman at an age 60, do they even know the kind of tests that when you get to that age, you're supposed to conduct, you're supposed to check at 60 so that tragedy does not befall you, does not strike on you inadvertently? And sometimes, even when tragedy strikes, how many believe that it is lack of information? A lot of them will think that, oh, it's maybe an uncle or an auntie in the village. Take the case of HIV/AIDS that ravaged the African continent and developing countries for so many years. It dealt with that. Also, and a lot of people lost their lives for lack of information. It was key. Many young people, many young girls died. And today, that aspect of lack of information, health information, is still bedeviling a lot of girls. For instance, how many of young girls today will know that if they stick to abstinence, they will avoid a lot of health challenges? How many? How many, even more important, know that if they are armed with information to resist sex for money? How many? When they are going through financial difficulties and a man offers them offers them money for sex, how many young girls will have the capacity, the information to resist on that, even when they're being offered sex without protection? How many are able to say no to sex without protection? Even when information is available, how many of them make use of it? So those problems are still there. Sometimes governments make a lot of effort and make sure that drugs are available. But what is the cost of such drugs? Okay, if the drugs are there, how many of those drugs are even original? We have issues of fake drugs. Now, fake drugs are even killing more than some diseases. You're sick and you run to the pharmacy only for you to meet an untimely death because you consumed fake drugs. A situation where a medical doctor will prescribe a drug and says, okay, for instance, you're taking 200 milligrams, and then you buy a fake drug, and the it's not really the 200 milligrams written on the carton is not really 200, maybe it's 100 milligrams, and you're taking that, and you're not getting any better. That is the problem today. Remember, the Bible says that my people die for lack of information, lack of knowledge. And that's where we are saying on this show that health communication becomes very vital. Health communication is one of the most vital aspects of public health today. Because if people are not aware of how they can change their behavior, then how will they do that? So there is need to trigger behavioral change. There is need to inform the people. And this takes public health. That's the role of public health to do that, because public health is a science of preventing disease, prolonging life, promoting health through organized efforts. And one of those efforts is communication. So population focus, and it transcends the walls of being in the hospital and talking to patients. It has to be deliberate, it has to be community focused, it has to be people focused. So, in today's interconnected world, public health challenges include things like pandemics. You know, we had a global COVID-19 pandemic, which we are not ready to forget so soon. We have chronic diseases, mental health crisis, which is very rampant today. We have environmental health threats. And then we even have emerging zoonotic diseases. Those are some of the public health challenges we're having today. And so some bodies have been working hard. We have global bodies such as the World Health Organization, the United Nations are providing frameworks. They're providing legislation. They are provide like the Sustainable Development Goals, the SDGs, which we look at on this program all the time, to do what? To guide action. Now, take the case of SDG 3, Sustainable Development Goal 3. That one specifically calls for good health and well-being. Okay, good health and well-being for all at all ages. Now, however, public health is not isolated. It's closely tied to things like economic development, education, gender equity, environmental and sustainability, because gender, education, environment affects the health of the people. Gender, for instance, is a very powerful determinant of health outcomes because it shapes access to services, exposure to risk factors, and the overall well being. Now, let me give you an example. Women often face barriers to accessing healthcare. Now, from financial constraints to societal norms, we know that women face those things. For instance, maternal mortality remains very high in many developing countries in Africa. It's still very high. Meanwhile, men may suffer from other issues. For instance, a lot of men suffer from mental health, and it's often overlooked because, oh, they are macho, they are men, they're muscular. Oh, why would they get, it's overlooked that mental health is a problem for men. Issues because due to their masculinity, that stigma around them that, oh, you're a man, you must not cry, men are strong. That's why you find a lot of men, they don't even go for checkups. Say, oh, even if I'm not feeling fine, I'll be fine. I'm strong, I'm a man. They don't cry, they don't complain, they don't. So that affects their mental state. And now, gender-based violence is another very pressing public health issue affecting physical, mental, and emotional health. So without addressing gender dynamics, health interventions will be very, very incomplete and even ineffective. So gender dynamics have to be taken into consideration. And if you want to look at a gender responsive public health approach, becomes very essential. For instance, programs have to be designed that recognize and address the specific needs, the barriers, and the rights of all genders. Such programs have to be designed beyond policies, healthcare services. Human behavior plays also a very decisive role in health outcomes. Now, if you look at behavioral sciences, it helps us understand why people do the things they do, or why they don't do the things they do. Why don't they adopt healthy behaviors? Or why do they adopt healthy behaviors? Now, things like vaccination. hesitancy. Well, a lot of people don't like vaccination. They hesitate over vaccination. Unhealthy diets, sedentary lifestyles, and even poor sanitation habits are very rampant. And those are good examples where behavior directly impacts on your health. If you don't have a clean environment, it affects directly your health. Small changes in environment or messaging can be very, very useful. They can encourage healthier choices. Now, you see that health education, understanding health education, involving health education can lead to a greater acceptance because information is very important. So, public health should really insist on information, education. Public health professionals must also integrate behavioral insights into the programs they design, policy development, community engagement to achieve better results. Now, don't forget that those are all the things we're looking at to improve on the general well-being, SDG 3, which is good health for all. So we're looking at that. And okay, don't forget to subscribe, follow us, like, and give us a thumbs up on the program. What do you think? Make a comment downstairs. How can we better improve on our health communication? How can people improve on their behavioral to improve their health? For instance, this aspect of dumping refuse here and there is also a, a behavioral challenge that impacts on people's health. Littering the gutters, not cleaning the gutters around the household. Those are some of the things. How do we help the population to know that these things are not good? So please share with us, comment, and then we will discuss down below. Now, at the global level, we have frameworks like the Universal Health Coverage Initiative. That's a very important framework. We have the Global Strategy for Women's and Children and Adolescents' Health. That's another initiative at the global health level. At the global health level, there's also the Paris Agreement, which addresses climate health impacts. That's another framework at the global level. So you see that effective frameworks have to be interdisciplinary. That means they should merge public health policies, they should merge gender equity considerations, they should merge behavioral science evidence. So when all of that have emerged, the policies become very effective. Now, if you look at cross-sector collaboration, it's also very important. For instance, a sector like the education sector, a sector like the economic sector, the human rights sector have to collaborate. Environmental groups should work in tandem with the public health sector because achieving sustainable development and health equity demands that we stop working in silos and we start embracing, integrating people-centered policies, culturally sensitive approaches. All these approaches will make our health better if they are integrated. We're talking about education, we're talking about economic policies, we're talking about environmental policies, climate policies, we're talking about behavioral policies. All of that should be integrated into public health for it to be very effective. So you see that today we are saying that achieving sustainable development and health equity is not just a task of one discipline alone. It's not just the task of public health alone. It requires a convergence of public health, gender sensitive analysis, global policy guidance, and then, of course, behavioral insights and analysis. So, but we're already doing something at IFL-SC Global Academy right here. We're taking part in a global move to make the world better, to make the environment better, to give people better health. At IFL-SC Global Academy, we believe in building knowledge, in building pathways that inspire leadership, that inspire behavior, innovation, and societal transformation. So we encourage the people, the youths, to change their mentality. We are doing that here. And this is where policies come in because global policies are formal agreements, they are frameworks, they are guiding principles developed by international organizations. countries will sit and come together and look at issues. Multilateral bodies will come together and look at issues, they want to address them, and so they come up with policies. And their primary purpose is to foster collective integration, collective work, and collective brainstorming in issues like public health, climate change, economy, inequality, education, peace, and human rights. That's what all these global policies always address. You find out, if you look at it very carefully, you see that global policy look at human rights, they focus on peace, they focus on education, they focus on economic inequality, they focus on climate change these days, they focus on public health. Those are some of the global debates that are going on around the world. So some of these policies by the United Nations, the World Health Organization, the World Bank, the G20, the African Union are very important. Some of them are binding and some are non-binding. You know, some are legal treaties, such as the Paris Climate Agreement. It's a legal framework, while others are voluntary frameworks, such as the SDGs, the dynamic. They're very dynamic and adaptive. So, but for us to make advancement and success, there must be what you call a holistic approach that integrates multiple sectors: health, education, environment, economy, security, recognizing their interdependence. Okay? Now, let me give you a classical example. A notable example is when the SDGs, that's the Sustainable Development Goals, there are 17 of them. They were adopted by the United Nations in 2015, I think. Yes, the SDGs were adopted by the UN in 2015 to end poverty, to protect the planet, and to ensure that there is global prosperity by 2030. That's what the UN did. And then in 2015, the Paris Agreement came, which became a legally binding treaty on climate change, aiming at limiting what they call global warming to make sure that it gets well below 2 degrees Celsius. And today we have also what we call the universal health coverage, which is generally known as the UHC 2030. It's also a global movement to ensure that all people have access to the needed health services without financial hardship. Yeah, okay, because health services could be there, but are they affordable? Is it easy for people to access them? So that's why these global strategies for women, for children, adolescent health are put in place. So to make sure that people can easily access them. So they're kind of like a roadmap to advance health and the rights of women, the rights of young people globally. Okay? So you find out that those global policies are not in vain. They're very important because they bring what you call standardization, they bring mobilization, they bring coordination, they bring even accountability mechanisms. They make sure that countries are accountable. Okay, they have to give account, and so they are kept on their toes. So global policies and global frameworks are very, very important. Now, we want to say that we have to promote partnerships across nations, across sectors, across communities, so that there will be a shared prosperity, a shared resilience. So share this episode with colleagues, with policymakers, with change agents. Let them listen. Subscribe to the channel, leave your comments below, your thoughts. What do you think? How can we achieve this global health we're talking about? Is it even possible? The UN said 2030. Where we this is 2025. Okay. Are we even close to achieving it? It's left to be done. I want to hear your comments, okay? So that we can have that debate after now, and invite you to stay tuned for more insightful episodes, because on this show we want to make sure that we talk about those things that directly affect the people, the communities, affects nations, even at the global stage. We look at the communities, grassroots, the communities. We look at nations, and then we look at the continent, and then we look at the global stage. Also, thank you for joining me. I will see you in my next episode. Thank you for watching. Remember that the collaboration model, public health plus gender plus policy plus behavioral science, will give us sustainable health equity. See you next time. Bye for now.
we would like to take, first of all, the prayer. We're going to be able to prayer, the national anthem, and then the anthem, and then the session. We'd like to call this time on the Provost College of Medicine, Biomedical University, Professor T.T. Harry, to give us a closing prayer. Please allow us to come in. Look forward to this great opportunity. Once again, we want to say welcome to the Bayelsa Medical University, where excellence is our host ever matriculation under the transformative, the dynamic, and the aspire Vice Chancellor of the Bayelsa Medical University, Professor Dimie Ogoina. A round of applause for that.